Welcome, everybody. It's the Radio Surgery Show with Dr. Gil Lederman, MD, New York's only Harvard-trained, triple board-certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WOR studios in the heart of New York City. And now, please welcome Dr. Lederman.
Hi, how are you? We have a special show today. We're here at WOR Live, and we're here with Chris running the show. We have Matthew making a special video, and we're recording this show. So we're talking all about prostate cancer. It's our first time ever that we've run one show all on one topic. So you're welcome to call us. Our number is 1-800-321-0710 if you have questions about cancer or prostate cancer. We're going to jump right in. The purpose of this show is to educate. Just like in medical school, when medical students learn patient by patient, learn diseases, and then residents and doctors learn one by one, patient by patient. This is what we're doing on this show. The purpose is education, for you to be a better patient, to be able to get better medical care, to give better information to your friends and neighbors, and also just understand how medicine works in New York and around the world. We have lots of patients from New York and lots of patients from the area, and also lots of patients from around the world, and you'll get different ideas about how medicine is practiced in all these places, and in big hospitals and little hospitals, and, well, you'll just jump in and see. So welcome. If you have questions, call us. Our office is open, and you're welcome to call our office for medical information or for the booklet DVD. Our office number is 212-CHOICES, 212-246-4237. If you have a medical problem or issue for yourself or your loved ones, give us a call at 212-246-4237. We'll mail you a booklet, DVD, or make an appointment for you, whatever you wish. I want to talk about a man, and every patient that I talk about is a patient that I've seen in the last few days. So often patients come to me and say, Doc, you talked about me yesterday on the radio. And I said, yeah, that's right. And I'll say, was I correct? And he says, everything you said was correct. And every time I've asked a patient if I've reflected their medical history properly, they've always said yes. So I take that as acknowledgement that my notes and my time with you are well spent. I want to talk about a man who's 61 years old. He's an Hispanic man. He was born in Colombia. He was referred by one of the biggest urologists in New York City. Why? Because he was recently diagnosed with prostate cancer. This man went to his primary doctor. He had few symptoms, a few. The doctor got a PSA blood test. A PSA is prostatic-specific antigen blood test. It's a simple blood test through the vein, and the next hour or the next day you get an answer. The normal PSA should be less than 4. In this man, it was more than 4. In fact, it was 5.28. So one can have prostate cancer at any level, even with a PSA that's low, 1, 2, or 3. It can not be inconsistent with cancer. So, of course, the physical exam is important, symptoms are important, but one does not need to have symptoms to have prostate cancer. So for this man, who's 61 years old, he's married with 2 kids, he came in with his wife, he got that biopsy because the PSA was elevated. What is a biopsy like? Lots of men are afraid. I had a patient this week who said, the doctor's going to come at me with a needle, and he put out his hands like how long a fish would be, like 2 feet long. My friend told me a prostate biopsy needle is 2 feet long, and it's so painful. And I laughed. I said, that's so far from the truth. I see thousands of men with prostate cancer who get biopsies, and when properly done, and the key word is properly done, patients feel nothing. Usually the man is sedated some. There's a little like spring-loaded gun that goes into the prostate like that, and in a moment the biopsy is done, the man wakes up, and I can tell you when properly done, no one ever says a word. There are some doctors, unfortunately, who are doing biopsies without anesthesia or without numbing up the man, and that can be painful, and I don't advocate that because there's many men who are going to die just because they're afraid to get a biopsy. And there's no reason to be afraid of a prostate biopsy. They should be easily done, safely done, comfortable, painless in the vast majority of men. And that's the experience that I know with doctors that I work with. So if you have a high PSA or symptoms and you've been just afraid of getting a biopsy, give us a call. Call our office at 212-CHOICES, 212-246-4237, and we'll meet and hook you up if you need to get a biopsy. Not every man needs a biopsy, so that's something one by one, and every case is unique. And people often will call me on the phone or call on the radio and say, Doc, I have this. And I'll say, look, I don't diagnose and treat people on the phone or the radio. It's best to meet in person. I don't like to cheat the patient, and I feel like spending a minute with the patient is cheating the patient. And you might cheat the patient out of their life. So I don't think that's fair. For every patient, they should come in if they want. We take most insurances, Medicare, Medicaid. We're located at 1384 Broadway and 38th Street in Manhattan, where we see patients and often, if necessary and if desired, treat patients with non-invasive treatment. So for this man, he was seen by one of the top urologists in town. He had a biopsy. It was painless. It was easy. He had a biopsy because his PSA was 5.28, and he came back with a Gleason score of 7. I should tell you that he had few symptoms. He had occasional times when he would wake up at night. But you don't have to wake up at night. You don't have to have pain. You don't have to have bleeding. In fact, most people with prostate cancer have no pain, have no bleeding, have no lumps, and that's what makes it a little scary. Some people are just waiting for something terrible to show up, and most men with prostate cancer have few or no symptoms. Some people have an enlarged prostate and then they wake up at night to urinate. Many men come to us with difficulty urinating or sexual problems. That's a very common reason for men to come and be evaluated. And I should tell you that many men come without prostate cancer to be evaluated because they want to know what their PSA is, they want to know what their prostate is, they want to have better urinary control and better sometimes sexual issues as well. So this man was diagnosed, he was sent by his doctor. Now we could say, why would a doctor send his patient to us? The urologist is a surgeon. Urologists often do surgery. Well, this doctor doesn't believe in surgery. He believes, and you can look at the data, we have plenty of data available. We have a prostate booklet that's available at no charge to you. And in this booklet, you'll actually see a graph of the complication rates of surgery. It's figure 12 on page 10. And you'll see that men who go through open or robotic surgery, and this is at one of the most famous medical schools in America, men who go through open or robotic surgery, I should tell you, what is the difference between open or robotic surgery? Good educational point. Open surgery means that the surgeon opens up the man and his hands are actually inside the body of the man. Robotic means the surgeon sticks a gizmo into the man, and there's a supposed robot, but it's really not a robot. It's more like a puppet. If the surgeon moves his hands up and down, the robot moves up and down, just following him. So that's the difference between open surgery and robotic surgery, and neither one is very desirable. If you look at the complication rates, and it's all here from famous medical school, actually from Harvard Medical School in Boston, recent data, sexual problems after surgery occur in 97% of men with open surgery, and robotic is 97.7%. So actually there's greater complications with robotic. I know this is not what most men are told. Most men are told, well, if you have robotic, we can see the nerves, we can see the blood vessels, we can cut better and avoid complications. In fact, the opposite is the case. Sexual problems are greater. 97.7% of men are adversely affected sexually after robotic surgery. And urinary problems, that means leaking urine or peeing in the pants. Wow, 80% with open surgery have urinary problems after open surgery for prostate cancer, and 86.8% have urinary problems after robotic surgery. So another reason why so many men come to us to avoid sexual damage from surgery, to avoid urinary damage from surgery, open or robotic. Now for this man, he has a Gleason 7 cancer. So why would the surgeon send him to us? Well, again, a simple point. This is seen on figure 9 in our booklet. You can see our data for Gleason 7 cancer with surgery or standard radiation at two famous medical schools, one in Boston, one in Philadelphia. Their best results are 60%. Our results are 90%. That's a 50% improvement. So it's easy to understand why men who have a Gleason 7 cancer, and this is just one category. I can show you the data for different PSAs, different Gleason scores. It's easy to understand why so many men come to us, because most men, I believe, want to avoid radical surgery. They want to avoid robotic surgery. They want to avoid surgery altogether. They want better results to keep their sex life and urinary life. So what happened to this man who's 61, born in South America, works in New York, been here for decades, married with 2 kids? He's coming with us. And he's coming with us because he saw this data. He saw he has a better chance to be cancer-free, avoiding robotic or open surgery, more likely keeping his sex life and urinary life. This is the work that we pioneered. It's a unique program treating men in a stereotactic frame with a short course of radiation. The benefit to the patient is it's a shorter course, accurate course, and with better results. So for more information, obviously, it's best to meet in person. My name is Dr. Lederman here at the studio. We have a special show today just on prostate cancer. We'll have more shows at 5 and 6:30 today on WOR. If you want medical information about prostate cancer or other cancers, give us a call. You can call our office at 212-246-4237. 212-246-4237. My name is Dr. Lederman. By the way, we take most insurances, Medicare, Medicaid. We're located at 1384 Broadway and 38th Street in Manhattan. We're going to take a short break. We're back and we're live, and you're welcome to call us at 1-800-321-0710. 1-800-321-0710. I want to talk about a man I just saw this week. He is a 65-year-old man. He came in with his son, and I know that many, many men think, well, prostate cancer can't hurt them. Prostate cancer is not such a terrible disease. Well, I want to give you an example of prostate cancer that is going to take a life, destroy a life. This is a 65-year-old man. He's married with 3 children. He has a devoted family and son, children. He was okay until 2013. In 2013, he came in with a PSA of 1,500. He did not come to me. He went elsewhere, went to one of the big hospitals. His doctors that were caring for him prior to that time apparently never obtained a PSA. He never got a PSA. He was never told about PSA. He was not interested in the PSA. I don't know the exact story. I didn't want to go into it because I didn't want to have hard feelings. But whatever happened, he was not diagnosed with prostate cancer until he got just 3 years ago with a PSA of 1,500. The cancer was widespread. He was started on hormonal therapy. Still to this day, hormones work for a while. How do hormones work? Well, prostate cancer and prostate grows because of testosterone. The hormones take away the testosterone. For a short period of time, the hormones work, take away the testosterone, take away the cancer, or make it go into remission for a short period of time. And it worked for a while, and then the cancer came rip-roaring back. This man had cancer growing on the spine. He had spinal surgery because it was interfering with his walking. He had standard radiation and standard surgery, and now he's in a wheelchair. He tried chemotherapy. It's really sad. He's having difficulty urinating because the cancer is growing in his pelvis. It's interfered with his urine. In fact, his kidneys are both blocked. So he's coming to us. Just came a couple days ago with terrible cancer, high PSA, in a wheelchair with cancer in the bones, cancer in the pelvis, and he wants us to help him. And, of course, we will help him. But if we have our choice, our druthers, we'd rather find men early when the PSA is lower, when the cancer is localized, when the goal is cure. In general, we like to cure, just like patients, just like you would rather be cured if at all possible. So why am I telling you this sad story about this man? Well, I'm telling you because we can learn from him. We can learn that just going through your life and not taking care of your health may be terribly destructive to you. He's 65. Most likely he won't live much longer. He's got a beautiful family, children, grandchildren, and he wants to. He wants to live, and he wants to get out of pain, and that's why he came to radiosurgery. We're going to help him get his kidneys opened up and his prostate opened up and take care of the pain and suffering, and this is work that we do every day here at Radiosurgery New York. And we'll talk about another man who came to us. He was born in South Carolina. He has a high PSA. He's had no biopsy. He's been refusing a biopsy. And this is A man I talked to you about a few minutes ago who said the biopsy needle is that long. Well, biopsies for needles of the prostate are not 2 feet long. So he unfortunately has been told stories that are not true. Biopsies can be easily done and painlessly done. He has a high PSA. I believe he should have a biopsy if he wants to know. Does he want to know? His PSA is 7. He's got about a 30% chance of having prostate cancer. That's a substantial chance. And if he came to us, if he had cancer, let's just say he had a PSA 7, Gleason 6, Gleason is how the cancer looks under the microscope, most likely he'd be cancer-free if he came to us, and most likely not only cancer-free, but would never see the cancer again. The treatment is easy with us, avoiding radical surgery, avoiding long, prolonged courses of radiation. We treat people in a stereotactic frame, so it's a more accurate system. We can focus on the cancer non-invasively. Treatments take about 10 minutes. Patients come into our office. We're located at 1384 Broadway in Manhattan, in the heart of Manhattan. So many people commute. They can take the buses, trains, subways to come to our office, get a treatment, turn around and go to work or home or go across the street to Macy's or Times Square or Bryant Park. You can do what you want and avoid radical surgery and have better results. Just look at our data. And we have plenty of data available. We have booklets, DVDs, and even this show is going to be turned into a DVD so you can have this information to give to yourself and your friends and your loved ones whenever you need and want to refer to that. I want to talk about a man that we just started radiation on. He's from Jamaica. Actually, some of the Caribbean governments have come to us to help because there seems to be an epidemic of cancer and prostate cancer in the Caribbean. Well, we've, of course, said yes, and we emphasize this to a great extent. I can tell you that 1 in 6 black men in America will get prostate cancer, so huge numbers, and 1 in 23 black men will die of prostate cancer in America. So many physicians are shocked and are working, and we are working too, to educate, to screen, to test, and to treat men with prostate cancer of all races, of course. For the black community, the risks of prostate cancer are higher than in every other community. So this gentleman is 66 years old. He's married. He has 2 daughters. He works at one of the biggest hotels in New York in a high position. He's had trouble with urinary retention. That means he was unable to urinate. He's had several episodes where he needed a catheter. He went to the emergency room because his prostate is so big. And he came to us because he has prostate cancer and he has urinary problems and urinary retention, and our goal is to treat him, cure him, and shrink down his prostate so he lives a better, normal life without prostate cancer interfering or taking his life. I want to talk about a 73-year-old man, also from Jamaica. He's married with 3 children. He's been on a variety of medicines for his medical condition. He was found to have prostate cancer. He was offered surgery. He declined that. He came for a second opinion because of his fear of surgery, knowing how it can harm him. He has friends who have had surgery and have not done well with surgery, and he's right. If you look at the data, most likely men will be damaged to their sex life or urinary life, more likely than not, with open or robotic surgery. This man has nocturia. That means he wakes up once a night to urinate. His weight is 149 and his height is 5'6". His physical exam, I examined him. He has a small nodule in the prostate. So for this man, most likely he will be cancer-free with us. He'll avoid the radical surgery, avoid the complications of surgery most likely. One question people ask is, how do I know I'll be cancer-free? That's a very common question. If you open our booklet and look at the back cover, you'll see the title is, How Do I Know My Treatment is Successful and My Prostate Cancer is Gone? We want you to look at that, page 11. And the title, the super title, is called PSA After Our Treatment. Well, the PSA, as the title says, the PSA should descend to 0 and remain there for the rest of your life. And there's many examples of men with different PSAs and Gleason scores, and you get an idea what happened to other men after our treatment. The idea is that the PSA goes down to 0, stays at 0, and never comes back. And if you come get treatment with us, or if you've been elsewhere and you want us to follow you, help you, come on in. We'll give you copies of your reports, copies of your pathology, copies of your scan, so you actually have possession of what's happened to you. We think that's so important for you to understand and know what's happened to you and have the documentation. Sometimes people when they're in the doctor's office, don't know the question to ask. That's why many people send me emails. You too can send me an email. My email address is gil, G-I-L, at rsny.org. Again, it's gil, G-I-L, at rsny.org. Many people want to learn more about us, and again, to call our office at 212-CHOICES, 212-246-4237 is a good way to start. Making an appointment is a good way to start. Our website is listenerssavelives.com, listenerssavelives.com, and look at the website. You can learn, educate yourself, and again, help your friends and neighbors and loved ones who have medical problems. And just by listening to this show, we have shows on every day, you may learn so much that you'll be able to help your friends and maybe even save their lives. My name is Dr. Lederman. I want to speak about a man who has prostate cancer. He had Gleason 7 cancer. He's 53 years old, so he's a young man, born in New York City. He had a PSA 15, Gleason 7, and he had radiation elsewhere, and his cancer came back. Well, another lesson. If you look in our booklet, page 2, you will see there's some hospitals that try to copy our work. This is one of the major hospitals trying to copy our work. And in this, you'll see their data versus our data. So, for example, you went to this famous hospital in New York City with his risk factors. You will see in the intermediate risk category, their results are 72%. Our results are 92%, 23% better. Remember, there's about 250,000 men a year with prostate cancer. If everyone came to us, you'd be talking about tens of thousands more men cancer-free every year if they came to us versus going to other facilities. So there's many, many reasons to consider Radiosurgery New York, Dr. Lederman, myself. If you have prostate problems or prostate cancers, just give us a call or make an appointment or come in or go to our website. You can have lots to learn, look at our information, or give a call with your questions, or better yet, an email. We are back. Thanks, Robin. We have a special guest who called us in. How are you today?
Okay, how are you?
I think I was told this is 007.
Yes, it sure is.
I heard it was formerly 007.
Formerly, now 004. So, hey, you know.
We have a special show today just about prostate cancer, so it's great that you've called.
Yeah, I'm ready to tell my tale.
Well, please do. There's many people who are listening, and they want to hear from a real patient what's it like to be diagnosed with prostate cancer and what goes through your head when you're diagnosed. And well, let's start with that. It was many years ago, right?
Yeah, it was. As a matter of fact, my last treatment was on the day after Thanksgiving, 11 years ago.
Happy birthday, happy anniversary.
Whatever, yeah. And we're coming up on that next week.
So 11 years. So tell us what happened. Why were you seeing the doctor? Why did you end up getting diagnosed? What happened exactly 11 years ago?
Sure. I take regular physicals, and also I have this obsession with recording all of my information, all of the blood work, the numbers on the blood work, and the PSA was one of them. And from, like, say, 1999 to 2005, my PSA was going up, not a lot, but from like a 0.9 to 1.2, and I figured in 2005 when it was 3.3, I said, it's going up steadily over these years. So let me look into it. Let me see if I have a problem. Well, I had a biopsy done, and it
So you got a biopsy really because of your diligence, not necessarily the doctor. Is that right?
Yeah, no, I had not been going to a urologist, at the time, and that magic number of 4.
Well, there's no magic number of 4. The magic number of 4 is a. Go ahead.
I'm aware of that. But doctors, regular, general doctors, think that 4 is the limit, is when you should start looking into things.
So you were actually able to teach your doctors a thing or two about anyone can have prostate cancer at any point.
Yep, I agree.
And so you went to the urologist, and were they reluctant to do the biopsy or enthusiastic about doing a biopsy with you?
No, they had, he was, very cooperative with that. The urologist I had was very cooperative. We did the biopsy. It turns out that I had, I had, not in every sample, but in some samples there was a positive result.
So there was multiple areas of cancer in your prostate with a PSA of 3.3. Do you remember the biopsy, what it was like? Was it painful?
Well, okay. I was listening to the program before. I didn't have anesthesia.
You chose not to. You're an Iron Man.
Yeah, I'm saying, what can I tell you? It's just my nature. I didn't want to.
Did it hurt you to have a biopsy without anesthesia?
Yeah, it was kind of uncomfortable. Let's put it that way.
Would you, if you had to do it again, if your friend came to you and said...
No. I get anesthesia, whatever they give you for it.
And it takes about a minute. You can get a shot and go to sleep, and then you wake up a minute later. It's like a spring-loaded gun. It just go bing.
No, I've had colonoscopies where they put you out, and then you wake up like nothing happened.
All right, so you regret.
I wouldn't do that again. No,
so you regret having a biopsy. So you're an Iron Man. So you had the prostate cancer. So what did the urologist tell you when he came and met with you? I assume it was a he. He came and met with you and said you have cancer. How did it go? Was that meeting?
Well, that's a tough deal to the sensation of the fact that you're being told that you have cancer is not, it's a very, bad feeling. Let's put it that way.
What was your age at that time, and were you working, not working?
57.
At 57.
At the time.
And you were working. And what went through your head? Did you think you're going to die, or?
No, I didn't think I was going to die. I just, okay, after it's like a body blow, and then I said I got to gather my thoughts and have it taken care of the way I want it taken care of.
And what was that?
Surgery was not an option for me. I did not want to get an operation.
Did the surgeon want to operate on you?
Yeah, he said I was a good candidate for right age and a good candidate for surgery. I said no. I'd rather I'd do something else. And I at the time I wasn't sure of your name, but I knew that you had a very important New York person that had that procedure done, the radiation procedure done with the seeds.
Mm-hmm.
So I had it looked into, found out it was you, and met with you, and I went through that treatment, which was very easy to do because there's no operation, there's no anesthesia, you're awake through the whole thing, and you just walk out of the office and go about your business for the rest of the day.
Is that what happened to you?
Oh yeah, absolutely. That's I conveniently was approximately 5 blocks away from the doctor's office, his treatment center. So I would, this is an important thing, and to prove that the procedure is non-invasive and doesn't affect you at all. I bicycle to work every day.
How far a bike?
At that time. And it was, varied from season to season, anywhere from 15 to 10 miles to sometimes 20, whatever. The summer was great, nice and comfortable out. Winter's a little different. But I bicycle to work every day.
Even during the radiation treatment?
And through the treatment. Exactly.
Even through treatment. So on a treatment day, you woke up, you live in Brooklyn, right?
Yes.
So
yes.
You woke up in Brooklyn, you got on your bike, you biked to Manhattan, you went to work, then you split from work, you came over, had a treatment, you went back to work, you finished the day at work, and then you biked home, right?
No, absolutely. Oh, yeah. There was absolutely no side effects to for this procedure at all. The positive side effect is that you put the cancer into remission.
Well, it's been now how many years?
It's going to be 11 years. Like I said, I go by the last treatment date that I had, and it's going to be 11 years next Friday.
So it's 11 years. What's your memory of the treatment? I treated you during that period of time. What's your memory? Do you have one big memory?
The office, the people in the office, the office itself was very, very. The people were great. The people that I dealt with were great. You're a great doctor. You make people feel comfortable. You played nice music in the office.
So it's all an uplifting experience. There was nothing negative that you had.
No, not at all.
And then you had the treatment, no side effects, nothing serious.
No.
Is that right?
No, not at all.
And then you'd bike home, have a treatment, bike to work, bike home, work all day, and then your PSA started going down, right?
Yep, it went from when we started the treatment it was 3.3, and now my last PSA it was 0.4. Well, not 0.4. 0.04.
0.04.
Right,
because last year it was 0.07. You were 007 last year.
Right, yeah.
You've been demoted to 004 now.
Yeah.
And your quality of life today, what's it like?
Oh, it's great, man. I'm leading the life here, Brett. I'm leading the life. I'm doing fine.
Okay, so urinary life, what's your urinary life like?
Oh, no problem. Yeah.
You urinate normally?
Yes. Normally have good sexual relationship.
3 times a day?
No. I can't do that, man. No.
Okay, so sex life is working, urinary life is working, and you're A-OK, in remission, no signs of cancer, and this is now 11 years later. Is that correct?
11 years later, yeah. I'm rocking and rolling. I'm really doing well. And, let me just mention the fact that I know somebody who had robotic surgery, and I sort of lost track with the guy until the other day. I saw him the other day, and several years ago, he got the robotic surgery, talked about it like it was the second coming, and his cancer came back. He had to go.
Now, you've talked about him before. You talked about him, not only did cancer come back, but he had a lot of complications, right?
Yeah, he had complicated. Now, I don't know how his balance that he has was affected by maybe the treatments the other treatments that he had to get, but he has to walk with a cane. He told me when I saw him the other day, he said his legs stopped working temporarily, and the guy's a mess.
He's about your age?
He might be a year or two older than me.
So he's about 69, something like that?
I think he's 70. I'm 68. I think he's 70. So, it's not really a big difference.
Do you ever talk about difference in treatment, our treatment for you versus what he took?
No, what am I going to say? Hey,
does he ever ask?
I'm not going to say his name. I'm going to say, look what I did, and I'm okay. Nah, I can't do that.
But does he ever ask? Did he ever think, wow?
No. You know what? Because he's convinced that what he did was okay. This is a little weird. He's convinced that what he did was the right thing to do. What am I going to tell him? What am I going to tell him, buddy? Look at you and look at me.
But why would he be convinced? Why would he be convinced that it was the right thing to do when he had complications, damage?
He never said he did the wrong thing. He never said he wished he did something else.
We had a man on the radio last week who had a Gleason 7 cancer, had surgery elsewhere, asked him how the surgery was. He said it was fine. And then he went on to say that his cancer is back, he's leaking urine, and he's impotent. And I said, how can you say the cancer surgery was fine when it failed, the cancer came back, and it caused impotence and incontinence? I said, when you tell people it's fine, it misleads other men to get surgery because they think you're telling them the truth, and it's not true.
No. Surgery is really something they should outlaw.
Well, every man should decide.
I know. It's just my expression, but It's apparently it's the wrong thing to do.
Any final comments for other men and families or loved ones who are listening who may have to deal with prostate cancer? How would you advise them to go about it, to think about life? What would you tell them?
This is what I would tell them. I said, if you, it's a little shocking to be told that you have cancer, okay? But I'm not saying my case is any different than anybody else's, but if you have the problem, don't hesitate, don't wait, don't do watchful waiting or these nonsense, hormonal therapy. Because I also knew a fellow that did hormonal therapy, and he said he felt terrible doing this. He was depressed. He had no energy.
Yeah, it's hard. Tell me something. Yeah. How has having cancer and now being cancer-free changed your life? Do you think about it anymore, or is it just a distant past?
You know what? I mentioned it to somebody a few weeks ago. Let me bring this up. I was riding a bike and got hit by a car.
I'm sorry to hear that.
No. That's okay. That's not a problem.
I'm sorry to hear that.
I basically, walked away from that.
You're lucky.
I didn't have anything other than a 8-stitch cut on my head, and that was it. There were a couple of scrapes, and a little black and blue surfaced a couple of days after the incident. But I basically walked away from getting hit by a 3,000-pound object.
Wow.
Okay. And I told somebody soon afterwards. As a matter of fact, it was my daughter's bridal shower. I was speaking to my nephew.
Congratulations.
And I said, you know what? Yeah, thank you. I said, you know what, Jamie? I said, you know what? I almost feel invincible because I beat cancer. I'll call it beat cancer. My cancer is in remission 11 years. I got hit by a car and walked away from it. And I feel invincible. I know I'm not.
Yeah, don't test it too much. Don't test it too much. You've had enough tests. Let's go to 120 years in good health.
Hey, sounds good. Listen, one thing. A PSA could go up to 1,500 because that's what I heard you say.
Oh, yeah, that was the man who came in. He didn't get care. PSA was 1,500, widespread metastatic stage 4 cancer. He went elsewhere, had care, and now he just came to us this week. So it's a sign for men out there. Please get care. Please get screened.
Yeah, don't wait, man. No, you're crazy if you wait. You don't wait. Don't hesitate.
All right. God bless you, Ralph. Thank you so much. Have great holidays.
Right,
okay. Bye-bye now. Thank you.